Good morning, everyone, and welcome to the MWR seminar series. This particular one is Medicare Planning. My name is Michelle DeVito with MWR. I'm the Family Programs Program Manager. First of all, I'd like to just welcome all of you that are new. It's great to see you. For those of you that are return customers, it's great to see you as well. We are very pleased that you've chosen to join us for this hour. Before we get started, I just want to give a quick thank you to Central Ohio Professional Education Council. Those are the individuals that are presenting for you today. Mr. Jerry Snyder, Nate Quilter, and Hannah Jacobs. So thank you very much for coming and for sharing all of your information in advance. Just want to touch on a couple of other things. We do have 2 more seminars coming up during the summer on retirement. The next one will be on Social Security, and that'll be in July. And then in August, we have Retirement Planning 2 years out, which will talk about different financial aspects of how to plan for your retirement, about 2 years out, but it's good information for anybody. So please join us for those. I'd like to go ahead now, and I'd like to introduce Jerry Snyder, who's going to be our speaker today. Jerry, come on out. He's with COPEC. And I will turn the podium and the clicker over to you.
Thank you very much. And I will add my welcome to you as well. I wanted to mention just a couple other things on COPEC. That's the Central Ohio Professional Education Council, who we are representing today. COPEC is a nonprofit. Maybe some of you have come to our other programs. Retirement Strategies is who I'm affiliated with business-wise. But COPEC is the nonprofit that has been in existence about 12 years, and it's composed of about 25 members representing different disciplines. And again, we're kind of representing the financial discipline, but you'll probably hear maybe in time other speakers. The speaker in a couple weeks is also from the COPEC organization. We would also invite you to go on our website. It's COPEC. COPEC, education.org, and you'll see the other speakers that give programs throughout Central Ohio on a variety of subjects that may interest you as well, over and above just financial. But all of our speakers, including myself, we really agree to do 2 things: give seminars such as we're doing today at no cost or no obligation. And we're definitely not here to talk about any products or really talk about our own company. It's strictly educational in nature. So please be comfortable knowing that. So I do want to mention, too, that this program today is no replacement for you doing further education on this subject. You know, talk to your benefits people, talk to your HR people, and you know, go on the Fed websites and gather as much information as you have. Medicare is just one of many issues that you would be facing in retirement, and many of these issues are irrevocable in nature. You know, when you make the decision, you can't change it. So get as much information from a variety of sources. I do caution you about talking to the person at the water cooler. Now, they may be thinking they're an expert, but, you know, they may be an expert for their own situation. But Medicare, as well as other issues, really impact different people differently and different families differently. So you need to, you know, get comfortable with the decision as it applies to you and your family. And I do appreciate, too, some of you may be here because you're helping parents with this and other issues as well. So let me just mention again, we're not here to promote our company, but just so you know who's talking to you, I did co-found a company, and it's based in Dublin. That's kind of the other side of the world from here, but we are a registered investment advisor and have certified financial planners. I mentioned, as it relates to a favor I'm going to be asking you, and it's just one favor, and it does pertain to the evaluation form that you were given as you came in. That form can be used for a variety of things. one of which, not least of which maybe, is that we really do appreciate your feedback and encourage that. It does really help us to report back to our nonprofit to tell them how many lives we've touched. So at the very least, say as much as you want. I will say that it's a 1 to 10 scale, 10 meaning excellent. So when you make the 10, it's a 1 and then a 0. So no, honestly, we want your true feedback. But the form can be used for other things, as you'll note. If you want additional information, we can email it, we can mail it on a variety of topics. And also, we do give a no-cost consultation to really see how this pertains to you and your family individually if you need some additional help. And we've made a little note about what's called a snapshot on that form as well. And that's kind of a high flyover that we have a program, again, no cost obligation, to help people visualize some of the other decisions that they would be making in retirement. When do I start Social Security? Should I consider long-term care? And some of those issues can be available to you if you so choose. So with that in mind, we'll kind of start marching through. I am going to be, and the other thing is, it's complicated. It's complicated, like many things are. So remember that I'm the messenger as we go through part of this, and not the creator of this. But I'm also going to probably be repeating some things throughout the program, just to kind of lock it into our minds, because it is complicated. So bear with me if you have the knowledge already. I do want to make sure that we kind of reinforce things, so I'll repeat things as we go along. So I bet most people in the room know that Medicare is comprised of now 4 different parts. And I'm going to go through Medicare generically, and then I'm going to try my best to go back and relate that to the health care options that you have as a result of your employment. So first of all, we're going to kind of go through generically just to get everybody on board. So Medicare now has 4 parts, right? Medicare A and B, A being hospitalization, B being pretty much all other medical acute type services, lab fees, outpatient, those kind of services fall under B. And that's referred to often as original Medicare or traditional Medicare. It's kind of important to remember that. Now then about, and don't quote me, but about maybe 15 years ago or so, Medicare decided to provide an option, and they outsourced the care that Medicare would normally provide. They outsourced that to local insurance companies, the Anthems, the Med Mutuals, the Humanas, and there's many others. And so what they did is they outsourced that in the way of a program called Medicare Advantage. So these insurance companies got certified by Medicare to provide those services. And we'll talk more about Advantage as we go along today. And then I believe it was 2004 or 2006, along comes Part D of Medicare, which is the prescription drug benefit. Now, I will mention this, and I'll go back onto that. I doubt if many of you would be needing to worry about Medicare Part D because of your insurance benefit that you would get from FEHB, or maybe you might be dealing with Medicare Advantage. You might elect for that, which has a prescription built in. I'm going to cover Part D a little bit later, but I don't think we have to go into it too much because I really don't think too many of you would be accessing that, but we'll talk about it. So let's go a little deeper into Medicare A and B. So A, as I mentioned, is hospitalization, but there's some other benefits that it covers as well, and that is skilled nursing, and there is some home care benefit under Part A, and also hospice for the terminally ill can fall under Part A as well. And then, again, under Part B, it would be your doctors, outpatient, preventive services, medical equipment is listed here, would fall all under Part B. And this little paragraph here reminds us that it wasn't intended to provide 100% of your care. So it's a part of your overall care package, but a very important one. And two, to distinguish, it's not long-term care, it's acute care, and it's medically necessary type care. It's not non-medical in nature, so that's important always to keep in mind as well. So of course, Medicare A and B has deductibles and copays, and those are listed here. And so just to touch on a few of those, under Part A, and this would presume that you didn't have any supplement to help pick up the deductibles and copays. If you didn't have any supplement whatsoever and you enter a hospital, there would be a Part A deductible of $1,340. And those change a little bit every year, but that could reoccur if you had more than one hospital stay, particularly for a different illness. So that could recur more than once within a year. Now, once that deductible is satisfied, either out of pocket or because you do have a supplement, then Medicare does an excellent job of usually the first 60 days in a hospital, although they push you out much sooner than that normally. They have pretty full coverage for 60 days, but after 60 days, we don't have this happen too often, we had a client that had a rare blood disease that really needed to stay in the hospital well over 90 days. So if they didn't have a supplement, they were going to have quite a daily copay to handle. But again, they were fortunate too. They had a supplement to pick that up as well. Skilled nursing, Medicare pays generally the first 20 days fully in a skilled nursing facility. And that would be for recuperation, not long-term care. So for recuperative purposes, the total benefit's 100 days, fully benefit for the first 20, and then there's a copay. It's now $167.50 per day. Again, presuming you don't have a supplement. If you have a supplement, much of that might be picked up. Now, I listed a premium here, but very, very, very rarely in my 30 years of profession have I run into anybody that didn't qualify or that had to pay a premium out of pocket when they retire. Why? Because they paid into Social Security. Now, again, I don't want to get too confused, and people can get confused, Medicare versus Social Security. But there is a few tie-ins, and one of which is if you're paying into Social Security, you're automatically building credits to qualify automatically for Part A. You'll hear people say, I get free Part A. Well, is anything free? No, it isn't. You paid into that, but it's free at the time you retire. Maybe because of a spouse qualified, or you yourself as the employee, chances are did as well. So it's very rare, but I did put that premium on there if you would happen not to qualify through prior employment. Now, Part B then, it too has a deductible, and that changes a little bit every year, $183 per year. Once you pay the first $183, then you go into like an 80-20 cost sharing with Part B. And so, but that 20% can be quite large if you don't have a supplement again, and chances are you will. So, you think about some of the surgeries and whatnot, 20% of a multi-thousand-dollar surgery can be very, very high. So we don't want people running on Part B alone without a supplement, or they have to be willing to take on a great deal of liability and exposure. Now, almost despite what decisions you make, you're going to probably end up paying a Part B premium, though. And I'll talk more about this later as well. For most people, it's indexed to income now as to how much you pay, but for most people, it's going to be, right now, it's $134 a month. So factor that in if you join Part B. Now, I will say that you folks in your profession, you don't have to join A or B. So we'll talk about when you might want to and when you might not want to. But because most of you have already qualified for A, you're very, very encouraged to join Part A when you're able to do so. And by the way, that's at age 65. We're all the same Medicare eligible age 65, as opposed to Social Security. You can start that at different ages, and you can get a more full benefit if you wait till what's called your full retirement age. But we're all the same Medicare eligible age, which is 65. So you're very, very encouraged, because it's not going to cost you anything, to go ahead and join Part A when you can. The decision might be, do I join Part B? And that's what we're going to spend quite a bit of time on as we go through, whether that's advantageous to you. Because, again, you don't have to. Some people may end up wanting to join Part B in addition to your FEHB, because although, a little bit of confusion here, although they cover the same services of Part B, they can more fully cover it by having both, but you will be paying more. So it's kind of, you're going to be weighing this decision as you go along, cost versus benefit. How much do I want to self-fund? How much do I want full coverage? And so I'm going to come back to that on some of your decision-making that you'll be facing. So I'm going to talk about basic Medicare, traditional Medicare, and the different parts of that. And then I'm going to be talking about this Advantage program that some of you may want to consider, and the pros and cons of that. But first of all, we're going to talk about Medicare traditional, so that we firm that up in your mind. There are 3 parts to it. That can be confusing unto itself, and yet, if properly designed, they can work very well together. And once you get them up and running, things can get pretty smooth on it. But it can be a little intimidating in putting those parts together. So again, Part A and B, hospital, other services. Then that middle box is your supplement. And that's going to depend individually on how you want to approach that supplement. Do you want your FEHB to act entirely as that supplement? Or, do you want to maybe not elect B and run with that supplement alone? Again, those are the choices. And then the Part D is the prescription drug benefit. And so, again, that's the third part of the Medicare. While we're on that subject, though, if you continue to work beyond 65, does anybody want to do that? No, you don't have to respond. But if you happen to work beyond 65 and you're still covered under your FEHB or whatever current health care you have, that is going to continue to remain as your primary coverage. And then whether you're under A and or B, that would be your secondary. So your first line of defense is your FEHB. As long as you're still employed, you're over 65. But when you're 65 and you're retired, it flip-flops. So your Medicare becomes primary, and if you hang on to FEHB or you have another kind of supplement, it becomes secondary. So that's kind of how that flip-flop works when you retire. So this is kind of just repeating it. I will mention that for low-income people, there's some option to get some additional assistance from Medicaid. And again, your FEHB may act as your supplement for many people. So I'm going to mention about Medigap policies or Medicare supplement policies. Again, this might pertain more to the private sector people such as myself, but there could be a reason why you might want to consider this in lieu of your FEHB. So these are the private supplements that many insurance companies offer, and it's alphabet soup again. There's many different plans you can pick, A through N, and what makes the difference between these different plans is how much of the deductible and co-pays that we talked about that Medicare A and B has. Some of these supplements will pick up everything. As long as Medicare pays something, the supplement will pick out everything. But if you're willing to tolerate part or all of some of the deductibles or co-pays, you can save in the premium because these have a premium. And so that's kind of how these work. And so again, as we go along a little bit later, we're going to talk about when you might want to consider that, or maybe a spouse, or again, maybe a parent if you're dealing with a parent. So that's yet another option that could have a fit. So we're going to go a little bit deeper now into the Medicare supplements again and the options that you have. So this graph represents two broad options: sticking with your traditional Medicare, or do you want to opt out of that and go into the Advantage type programs? There's pros and cons with both. But again, on the left side, for many of you, you might just do A, and then you might have your FEHB program as your supplement, or you might have A and B and your FEHB program, which gives you more full coverage, picking up more, and maybe totally, it could pick up totally your out-of-pocket expenses. But you're going to incur some extra premium if you have both. But some might be very comfortable. I'm going to do A. I'm going to do my FEHB. I'm not going to elect B because B costs $134, and I'm in good health, and I'm willing to tolerate some of the copays. And so you're going to go through that analysis. And but by keeping FEHB, they have a prescription plan, right? So you probably don't have to do D, and the government does not force you to take D if you have what's called other credible coverage. And your prescription benefit, FEHB program, does have a prescription drug built in that's at least as good or better than the Part D that you would get from the outside program. So that's what you might be doing on the left side. But what you can also do is to consider going on the right side, which is your Advantage programs. Now, when you do that, technically you are electing off of traditional Medicare, A and B, and you're shifting the care and the burden of your care onto an insurance company. Pros and cons. On the left side, no networks. You can go anywhere you want, anywhere in the country, anytime, any kind of provider, and as long as that provider accepts Medicare, you're good. On the right side is networks of some kind. You're probably used to a network now. Maybe it's working fine for you. The networks on the right side, the Advantage programs, usually take on one of two approaches. It could be an HMO or it could be a PPO. Everybody know the difference between those two? Well, we'll talk about it just to make sure. An HMO is a very strict network that you must stay within that network to get coverage at all. If you go outside that network, be it a hospital, a doctor, a physician, other kind of care, if you go outside, you won't get coverage at all because it's a very strict HMO network. And it's usually a close regional network that you must stay within. Now, sure, if you're on vacation, something happens to you, you can get emergency service anywhere, but they're going to want you to hightail it back to your home HMO territory as soon as you're mobile and able to do so. Versus, again, on the left side, you could stay down to Florida for 2 months and get your care there. So that's one difference. It can either work for you or not. But you must, now the PPO is a little bit more liberal, and I'm still on the right side here. The PPO says, yes, we have a network. To get maximum benefit, you need to stay in your network. But if you go outside your network, we're still going to cover it. But we're not going to reimburse you as much as we would if you stay in your network. So that's a difference there as well. On the left side, you're paying a premium for that supplement. You're paying, although we think it's pretty generous, in my estimation, your FEHB premium, at least for you as a single, we think is very nice. And so you're going to pay that premium on the left side, right? And if you elect B as well, you're going to pay the $134. So you're paying a premium there. On the right side, by the way, they put everything as graphed here. They put everything into one plan. You don't have these different parts. It's all in the same plan. Your supplement is incorporated with your basic benefits. It all works together. But on the right side, maybe an advantage is no premium or a very low premium for Advantage type programs. So it might tend to favor somebody that's in excellent health, doesn't go to the doctor much, and those kind of things. So what somebody might do in your circumstances would be, and you've heard the term, I bet, suspend. You're going to suspend your FEHB healthcare option. Don't cancel it, because you might not ever be able to get back on it, but you would want to maybe suspend so you save that premium and you're letting Advantage and those programs cover everything. Now, you know, nothing is free, remember? So, although you're not paying a premium, be careful because you might pay as you need services. On the left side, you're paying a premium, but whenever you need the service, you're probably paying virtually nothing, maybe a little bit of a doctor copay. But when you have a lab fee or a bigger surgery or something, you're practically paying nothing on that left side because you've paid a premium. On the right side, no premium, but when you need the lab fee, expect to pay maybe $50 on that side. Now, again, I'm talking generally. You need to really investigate the Advantage program as offered by your employer in your retirement plan, because they have one specially designed for you. So you need to check that out. But in general, those are some of the offsetting pros and cons and advantages. Okay. So as I mentioned, this Part B premium for most people, and this chart shows that as well, $134 per month. And that has been inching up a little bit every year. And it is now, however, indexed to your income. So they're going to look at all your income. And it's kind of retroactive. They're going to look back a year or two, see what you've paid in taxes or what you've had as income, and then set your premium accordingly. So again, unless you exceed like $85,000 as an individual or $170,000 on your modified adjusted income, that's your last line of your 1040 usually, then you would be in that 134 area. Sometimes people win the lottery or something like that, or in a short period of time, they may have accelerated income, which could throw them at least temporarily into a higher. So just be aware of that the premium is tied into your income. Now again, I don't know how far to get into Medicare Part D because I really truly feel if you stay with FEHB, you're going to get your prescription from there. If you go to the Advantage programs, you're going to get your prescription from there. But maybe you're dealing with a parent. There can be some exceptions where you may be better served. So Part D came into existence, and so actually if you didn't have other credible service and you didn't sign up for this, there can be penalties, severe penalties each month you defer. But because you have the options, this should not happen to you. But there are copays and deductibles with the D program, and they range all over. There is many options. And actually, if you happen to be in these Part Ds or you have a parent that is, you're really encouraged actually to shop it out every year. And there's no disincentive to do that. That is one thing that, you know, they'll waive pre-existing conditions. And because the insurance companies are changing formularies all the time and changing reimbursements for prescriptions, and I will say, for a government website, it's very well run. You can go on and you put your prescriptions in, and it's going to line up for you the best plan for you if you get involved in these prescriptions. So generally, it may or may, the prescription plans with Part D may or may not have a premium. Some don't, some do. Then after that premium that may or may not exist, there's a deductible usually, and that can range. I think our slide might be wrong when we get to that. It can range from nothing all the way up, but it can't exceed, and this is a little bit off, it can't exceed, like, I think it's $435 this year. So you know the companies can't charge more than that. And then based on how much drug costs you do have, you're going to get into different tiers of reimbursement, which also depends on whether you have generic type brands or, you know, preferred type brands. You might have heard of this donut hole, which is once you get to a certain level of benefit, you go into a kind of a different cost sharing with the government. It's kind of going down year by year, fortunately. But I think right now you would be paying about 44% of a lot of your drugs in that donut hole, which covers your costs from $3,700 up to $5,000. Once your drug cost hit $5,000 annually, you go what's called out of the donut hole, and the government picks up the lion's share. I believe it's 95% of the drugs for catastrophic cost. So again, hopefully I don't think most of you are going to have to worry about that, unless, again, you might be dealing with a parent. So I promised to go back and repeat myself, and I'm going to do it again because it's sometimes hard to grasp. Your options, I think, will basically come down to you're going to join Part A probably. No reason not to as long as you've qualified. It's free, and it covers hospital. And when you do retire and you're over age 65, it's going to be primary. And so they're going to pay first for your hospitalizations or skilled nursing, maybe some home care under certain circumstances. And then you're going to decide, do I want this Part B? And Part B has that 20% copay. So am I willing to, you know, get more of that covered? And if you do want that, it would lend you to probably adding FEHB in conjunction with that. To reverse that, maybe you don't want to join B. Maybe you don't want to pay that $134. Well, you're still going to have your FEHB, and it's going to cover the same services, but maybe not as fully. And so that's where you may want to add the Part B, and you're going to look at that and assess that. And then again, most of you won't worry about the Part D. If you, I'm sorry, that's a month. I might have misstated that. So that is a month, 134. And so again, generally you're going to stay on that FEHB, and so you'll pick up your prescriptions on the left side. And if you do that configuration again, you can go anywhere, no networks, and get the care you want where you want it. On the right side then, no networks, as I mentioned, a lower, maybe no premium, but you're going to pay as you need services. And by the way, and it's something for you to check with the Advantage program offered by your employer, if you have a major surgery, they're going to have a stop loss. I haven't mentioned this yet. So it's going to be the maximum amount you would pay out of pocket, let's say for more of a major surgery. That could be $3,000, $4,000, $5,000. Well, again, if you stay in real good health, you're not paying that because you don't need the service. But if you needed it, we're glad it's there, but it could wipe out your premium savings pretty fast. And again, I'm not trying to influence you, of course, either way. But that's what you kind of figure out. What is my health? What's my health history? We don't know. We can't predict exactly. But balance those extra premiums with you know, these out-of-pocket expenses that you might have to occur with the Advantage program. The other thing, and we're not totally sure about this, but we have a pretty good instinct, is if you don't join B when you're first eligible for it, you don't have to, remember. The government is not requiring you to. But if you wanted to get back to that later, we believe you might have to incur a penalty and a higher cost to get back into it later. Medicare will take you back without pre-existing conditions, but you may get penalized kind of as you would with your Part D if you fail to get on that when you're eligible. So be aware of that as well. So there's extra costs involved in the two differences. And kind of you're going to kind of go through
I have a question with regards to what you just said. I have a couple of friends that retired back in 2000 from here, and one elected to take the Medicare Part B in that 7-month time frame, 3 months before you turn, the month you turn, and the 3 months after. So she's paying that normal price. The other one didn't because she had her health care here, which was fine. Now that she's older and she had to have 2 major surgeries in 1 year, it killed her and she couldn't pay the money. So she went back to join that Part B, and she pays a 10% penalty for every year past that year. And that's not a one-time penalty, that's a lifetime penalty. So where the one's paying $134, the other one's paying $200 and something. And another person I know said they had a friend that did that, and they're paying $300 and something a month. So you do want to join, if you plan to join that B in that 7-month period, or you're going to pay a lifetime penalty of 10% a year for the rest of the time.
And I'm glad you brought that up. I will say that there are some exceptions, though, maybe based on divorces or the death of a spouse or something like that. So there could be qualifying events where you can get back on without a penalty, but I appreciate the question because it could come into play often for many other people. So I think that's a good warning.
Please let us know if you have a question. We've got microphones in the back. That way we can make sure, since we are recording this, that everyone gets to hear what the question is, okay? We'll bring you the microphone. Look at the hands go up. Yes.
Another, I might mention this before the question, is another possible concern too, and you've probably heard stories about this. Again, on the right side, Medicare Advantage, you want to make sure that your doctors are in the plan to begin with, and the hospitals you prefer, because it could be that either the HMO or the PPO could restrict you. And what happens, and it happened to my wife, her doctor got mad at the reimbursements that the Advantage were providing, so he pulled out of the network, and so she couldn't. Now she's going to try to follow him to another Advantage program, but this happened in April, so she couldn't go to the doctor until the next January when there was an open enrollment to get into another plan. So these are concerns too that be aware of. Yes.
Based on her last statement about having that 7 to 10 month period of time to sign up at retirement, if you retire prior to the age of 65, would you still sign up, or would you wait until you hit 65?
You can, in general, you can sign up 3 months prior to turning 65, or the month you turn 65, and then they give you 3 months following to, again, if penalties would apply, to avoid the penalties.
Okay, even if you've already been retired in your late 50s?
Now, if in your late 50s?
Yeah, under CSRS, some of us are eligible to retire at 55 and 56.
Okay.
So we'd still wait till we were close to our 65th birthday to sign up?
Are you going to be covered for health insurance up till that time?
Yes, under FEHB.
Yeah. So then, yes, I would say generally, Nate, would you agree with that? Yes. Yeah, that you could wait till 65.
With no penalty, okay.
Yeah, no penalty.
So it's more on the birthday than the retirement age?
Correct.
Okay, thank you.
Anybody else?
Okay, I am one of those that, I'm turning 65, but I'm not retiring till 66. So I called Social Security, and this is maybe about what you said. They told me, because I said, do I have to sign up for Medicare now? And they said, no, since you're still working and you have FEHB, you don't have to sign up till you retire. But am I going to pay a penalty for not signing up?
No, as long as you, and I don't know if you're addressing this to somebody else, but
Okay.
from our standpoint, no, because you're still working, and only when you separate from service, you could be 85 years old, no penalty until you separate from service, because you have qualifying coverage up till that time.
Okay, so that's what they told me. I just wanted to make sure I was
Yeah.
correct. 'Cause I didn't.
So if I understand it correctly, as long as I have health insurance, if I turn 65, I don't have to worry about Medicare. But if I retire before, like this lady over here, at 56, I keep my federal insurance, then I have that 6-month period where I have to make sure that I enroll, correct, upon 65.
Yes.
Thank you.
Any others?
Are these slides going to be available for us?
Yes, ma'am. Actually, and I'll use my camp voice, and hopefully it'll be picked up by the recording. We'll also be recording, excuse me, in a couple of days, we'll also have the recording available.
If we suspend it,
Can I ask you to just hold for the microphone?
I'll ask my question first then.
Camp voice?
Okay.
say for instance, you're prior military, so, and you can get, hospital coverage at the VA, and you suspend your FEHB, and that can be suspended, as far as I was told, indefinitely. So, but if it's suspended, does the Medicare, how does the Medicare payment happen? Because if you're suspending your FEHB, then you're not paying into Medicare. How would that work?
I'm not sure.
This is what I'm asking.
I'm not sure I'm going to be able to answer that. But you would continue to have VA coverage?
Yes.
Is that full coverage for hospital and? I'm not comfortable answering that. My impression would be I would think you'd be fine as long as you had credible coverage leading up to that. But I would be most encouraging to get that checked out through your other sources.
And what other sources would that be?
I would
Do you
imagine.
know?
I don't know if your employer can help with that or the VA themselves. Okay.
With the microphone, please, because they're actually in the recording room. I just got the reference.
If you are a veteran and you're retired and you're getting,
Not retired veteran, but I'm no longer veteran. I'm an ex-veteran.
if you are getting TRICARE, which a lot of veterans are getting, and if that's your sole source of insurance, when you turn 65, you must sign up for Medicare A and B. If you do not sign up for B and pay the $134 a month, you will lose your TRICARE automatically. And that happened to a lot of us last year, and we lost it. And then once we signed up for the B part, then they gave us our TRICARE back.
So are disabled vets considered to be on TRICARE? Because I'm not on TRICARE.
You may be an exception. I just know that a lot of us that are retired, we have TRICARE, and we lost our TRICARE for not signing up for Medicare B. You always sign up for the A part, but if you don't sign up for B, you will lose your TRICARE.
One note on that also, with the TRICARE for life, you'd want to do it before your 65th birthday. There's that 7-month window that Jerry mentioned, that's for traditional Medicare. With TRICARE for life, you want to do it by your 65th birthday.
See, I don't have TRICARE, so I need to find out differently. I'm on the disabled, so I think so.
And I think probably your best bet would be that if you shoot me an email, I'll reach out to VA and we'll see if we can't find somebody over at VA to assist you with those questions, okay? So please, any questions that we don't have the expertise to answer now, Please send me an email, and I will work very diligently to make sure we get an expert that you can be in contact with or an answer, okay? My email is Michelle, M-I-C-H-I-E-L, .devito, D-E-V-I-T-O, @DLA. You know the rest.
I think another factor here is, and I hate to introduce this possibility, but if the government would stop offering retirees, as many in the private sector has, that might bear consideration in terms of your decision as well. Now, if that were to happen, I think it would be a qualifying event, so I would hope and not think that there would be any penalties then for getting back on other plans. But we always kind of have that in the back of our mind, particularly when we're dealing with private sector companies that often are doing away with their retiree health care plans.
My wife is turning 65 in August. She's covered under the FEHB. Does she have to apply for Medicare?
I believe she does, doesn't she, Nate?
No, but she'd still be able to cover under your coverage.
Right. I think she would want to, I think, at least apply for A.
So she'd apply for Part A?
At least.
Okay.
Yeah.
Okay.
And then they could direct her if anything else is necessary. I don't think it would be.
Okay, great, thanks.
Yeah, whenever you turn 65, I think even if you're continuing to work, I think they're going to encourage, you don't have to, encourage you to join A. It would help fund those benefits.
What about dental and visual?
Oh, I'm so happy you mentioned that. I avoided that, or not intentionally, but so that, back to our chart, if I can get back there. That is an advantage, of course, of FEHB, because I don't know how rich the benefits are, but you have life insurance, you have dental and vision, at least some benefit there. Medicare traditional does not offer that. Thanks for your question. Advantage, the right side, usually some of them, and I'm not sure about your government plan, though, so it's something for you to check out. Then often it could be incorporated in there, some of the companies incorporated in there. But yes, if that's very, very important. Now, I think there's a cost-benefit analysis to that, quite frankly, as well. How much are your premiums and what is your benefit from those vision and dental? So I don't know that that totally should influence your decision, but it's